Hi, and thank you for joining Telecare's Consultant Corner, a short video on general health inquiries submitted by local Australian GPs, answered by our Telecare physicians.
Hi, my name's Chris. I'm a nephrologist with Telecare, and today I want to give you 3 tips for patients with difficult to control hypertension. So let's get right into it. Tip number 1, measure home blood pressure. It's really important that you encourage patients to measure their home blood pressure. The reasons are multiple. Firstly, white coat hypertension is very common, and in chronic kidney disease patients, the prevalence is as high as 30%. Secondly, masked hypertension, which is normal office blood pressure but elevated home blood pressure, is also very prevalent, about 10% in the general population and up to 50% in the chronic kidney disease population. So often, if I have home blood pressure monitoring readings, I often ignore the clinic blood pressure readings because I find that the home blood pressure readings are much more important. They offer superior prognostic value as compared to office blood pressure readings for mortality, chronic kidney disease, and cardiovascular events. So that's my first tip, home blood pressure monitoring. My second tip is dietary sodium restriction. We should be encouraging our patients to try and restrict their dietary sodium to about 2,000 milligrams a day or less, keeping in mind that the average Western diet has about 5,000 milligrams per day of sodium. So patients are going to need to more than halve their dietary sodium intake. But doctor, I don't add any salt. I hear this all the time. Most dietary sodium is actually hidden in foods, and it's not salt that we add on top or at the table or during cooking. And if patients don't read food labels, they probably don't know how much sodium they're consuming. You really have to take care and look at the sodium content in the foods that you're purchasing. So how effective is sodium restriction? So this study looked at the combination of dietary sodium restriction and the DASH diet and found that the combination of these two things can actually result in large blood pressure drops of 20 millimeters of mercury systolic in hypertensive subjects. My third tip is to use spironolactone. The prevalence of hyperaldosteronism in the resistant hypertension population is as high as 20% in some studies, and more recent evidence suggests that perhaps this is a continuum rather than a dichotomy, and we really should be using spironolactone in more patients. The Pathway 2 trial gives us good evidence to recommend spironolactone in resistant hypertension. In this trial, patients who were on RAS blockade, calcium channel blockers, and a diuretic were randomized to spironolactone, bisoprolol, or doxazosin, and spironolactone came up on top. Here's a visual representation, and you can see that spironolactone was superior to doxazosin and bisoprolol, and of course placebo as well. So those are my 3 tips. 1, encourage home blood pressure monitoring. 2, encourage dietary sodium restriction. And 3, use spironolactone liberally, but of course, monitor the serum potassium. Thanks for listening. I'm Chris Sear for Telecare. See you next time.
Thank you for watching. If you would like to submit a question to Telecare's Consultant Corner, please feel free to email us at admin@telecareonline.com.au. Telecare, putting the care into telehealth.